Hey there, viewers! A pulmonary embolism, also known as a PE, is a common and incredibly dangerous type of blood clot that you need to know about. Untreated, about 1/3 of people who develop a PE will die. However, if you catch it early, you can significantly reduce your risk of permanent lung damage and death. This is why it's so important to know the signs and symptoms of a PE and to seek immediate medical attention if you think that you might have one. However, some of the symptoms may not be so obvious. So unless you know what to look for, you may have no idea that your symptoms are actually due to a blood clot. Keep watching to find out if you have any of the risk factors that could make you high risk for developing a PE, and learn which surprising symptoms could indicate that you have a blood clot. Real quick, don't forget to like, subscribe, and comment below. First, why is a pulmonary embolism so deadly? A PE is a blood clot that develops in a blood vessel somewhere within the body that breaks free from that location and then travels to the lungs. The blood clot gets lodged into an artery within the lung, and this prevents blood flow to that part of the lung. Without blood flow, that portion of the lung will die. In most cases, the initial blood clot is formed in a deep vein in the leg and is called a deep vein thrombosis, or a DVT. However, clots can also be caused by other substances, such as air bubbles, amniotic fluid, or a piece of fat from a broken bone. There are several risk factors that increase your risk of developing a blood clot. Let's talk about them. 1. Medical history. Certain medical conditions significantly increase your risk of developing blood clots. These conditions include, but are not limited to, cancer, clotting disorders such as factor V Leiden, pregnancy, and COVID-19. 2. Surgery. Recent surgery is a major risk factor for developing blood clots. There are several reasons why surgery increases this risk, but one of the key reasons is that during and after surgery, you're more likely to be inactive. When you walk, your muscles squeeze blood out of your veins, which prevents it from pooling in your legs. However, when you're recovering from major surgery, you're less likely to be active. Being inactive can cause blood to collect in your legs, which can lead to the formation of blood clots. 3. Immobility. Prolonged periods of immobility increase your risk of developing blood clots. People who have jobs that require them to stay seated for long periods of time, such as truck drivers, are stuck in a cramped position for hours on end. Similarly, people who have taken a long plane ride or car trip may be seated for several hours, which can cause blood to pool in their legs. When you travel, it is very important to get up and walk around several times throughout your trip to prevent the formation of blood clots. 4. Family history. In some cases, genetics may play a role in the development of blood clots. Therefore, your risk of developing a blood clot may be increased if you have an immediate family member who has had a blood clot. What are the warning signs that you may have a pulmonary embolism? The most common symptom is shortness of breath. However, there are less obvious symptoms that may indicate that you have a PE. Other symptoms of a PE include chest pain when you take a deep breath, cough, which may contain blood, back pain, fainting, a fast heart rate, and clammy or bluish skin. You may also have pain and swelling in one of your legs, which could indicate that you had a blood clot in your leg that then traveled to your lungs. If you notice any of these symptoms, you should go to your nearest emergency department immediately. If you are at risk of developing a blood clot, what can you do to decrease your chance of clotting? While traveling, there are several things that you can do to prevent the formation of blood clots. First, take a break from your seat and move around. If you're on a long road trip, pull over to a rest stop and get out of the car. If you're on a plane, move around the cabin. Movement is the number one thing that you can do to prevent a blood clot. Second, compression stockings can be useful to promote circulation in your legs. If you know that you have a long trip ahead of you, you can purchase compression stockings to wear during your journey. Lastly, try to stay hydrated by drinking plenty of fluids, as dehydration can contribute to the formation of blood clots. If you have recently had major surgery, your doctor will likely put you on a blood thinner to thin your blood so that it will be less likely to clot. You may also be encouraged to wear compression devices on your legs that automatically inflate and squeeze your legs every few minutes to improve your circulation. It is important to start moving as soon as possible after surgery. Your nurses will likely encourage you to start walking soon after your procedure because walking has been shown to lower your risk of developing a blood clot. If you have been diagnosed with a PE, it's important that you start treatment immediately. Most people will be put on a blood thinner, which prevents the existing clot from getting larger and prevents the formation of new clots while your body dissolves the existing clot. If you have a clot that is in a more life-threatening part of the lung, you may also be placed on a medication called a thrombolytic. Thrombolytics actively break down existing clots, but they are not used on everyone because they are associated with a high risk of bleeding. In addition to medication, some people may need to have a procedure to remove the clot directly from the lung. This procedure comes with risks, so it's reserved for people who have very large and life-threatening blood clots. Have you been diagnosed with a PE? What were your symptoms? Share your experience with us in the comments below. If you liked this video, give it a thumbs up. To learn more interesting facts about the human body, subscribe to the channel. Here are 2 more videos that you should check out to learn more about your health.